I'm Instructor Hickman with Modern Warrior School, and this week we're taking another look at trauma kits.
Mark Twain once said, "The two greatest days of a man's life are the day he's born and the day he finds out why." Well, I was born to be a warrior. What about you?
So last November we posted a video on trauma kits, but being one of our first, it honestly could have been done better. Much better. The video we posted didn't offer much educational value and is borderline unprofessional. Trauma kits are a life-saving piece of equipment and deserve a better examination than we gave it last year. So without further ado, let's dive into it. First of all, what is a trauma kit and how does it differ from a standard first aid kit? First aid kits are designed with common minor injuries in mind and are primarily stocked with bandages and maybe medications like Tylenol. Trauma kits, on the other hand, are built with immediate life-saving in mind, like car crashes, gunshot wounds, and other traumatic injuries. As such, their focus is on the MARCH algorithm, which stands for massive hemorrhaging, airway, respiration, circulation, and hypothermia and head trauma. This is the standard assessment used when evaluating and treating traumatic wounds. What you carry in a trauma kit will primarily be based off your level of training. Keep in mind that without sufficient training, you aren't a help, you're a liability. This video does not substitute proper training, and I recommend at least getting certified in stop the bleed, basic life support, and tactical combat casualty care, if not advanced cardiac life support and emergency medical technician as well, to learn how to safely perform these interventions. Since the program began in 2016, Stop the Bleed education has become increasingly popular, and for good reason. Left unchecked, a casualty can bleed out in mere minutes, thus why controlling massive hemorrhaging is the most pressing step in MARCH. It also requires a minimal amount of training to become proficient in, and is non-invasive, meaning it carries little risk of worsening injuries. Besides, bleeding is the #1 cause of preventable death after an injury, so when it comes to getting educated, Stop the Bleed is a good starting point. Having a rather narrow focus, these kits are quite simple to put together and have a low barrier to entry. First up is something that deserves a place in any trauma kit, a good set of shears. You can't treat what you can't see, so your first step is going to be exposing the wound. There are a ton of trauma shears on the market, and they vary wildly in price. While Leatherman Raptors may be nice, if you're just a prepared citizen as opposed to a medical professional, you can get away with something cheaper. This allows you to either stock up on more kits and stage them everywhere, or to treat your shears as disposable and work with potentially infectious patients. Next are tourniquets, the first line of defense against massive hemorrhaging of the extremities, but they come with some risks when left on for too long. For that reason, you may want to mark TQ along with the time it was placed on the victim's forehead. There are a ton of tourniquets on the market, but they aren't all created equally. Ensure that the tourniquets you purchase are approved by the COTCCC. The Soft T Wide is my preferred tourniquet, though I also have experience with CATs. Tourniquets should be placed at least 2 inches proximal or closer to the torso to the wound, though there's nothing wrong with the classic high and tight application. After looping the tourniquet around the injured limb, pull the excess webbing before rotating the windlass until the bleeding stops. If one tourniquet isn't adequate, apply a second one proximal to the first. Then there's gauze, which is used to pack junctional wounds such as the hips, shoulders, or wounds to the extremities that are too high up to place a tourniquet. They come in 2 varieties, traditional and hemostatic, yet both are used the same way. Simply pack the gauze inside the wound as tightly as possible, then cover the wound with a pressure dressing. While most traditional gauze is more or less created equal, you want to be more careful in selecting hemostatic gauze. The 2 industry leaders for hemostatic gauze are QuikClot and Celox, with similar efficacy for both. Hemostatic gauze may also become less effective with age, so keep an eye on expiration dates and rotate as necessary. Lastly are pressure dressings, also known as the Israeli bandage or emergency trauma dressing. With the wound packed, place the non-stick pad part of the dressing on top of it. Then, pulling the dressing tight, wrap the bandage once around the extremity and pass it through the pressure regulator, pulling it taut, before wrapping the bandage in the other direction. Finally, use the locking bar to secure the end of the bandage to the wraps. Now let's talk about TCCC, or Tactical Combat Casualty Care, which is the basic course for combat medicine taught to the military, though there are classes available for civilians as well. TCCC is focused around self and buddy aid using an individual first aid kit, or IFAK. It does not include performing advanced interventions, but takes stop the bleed a bit further and includes basic airway management as well. Now let's take a look at what's typically carried in an IFAC. IFACs generally contain the same equipment as stop the bleed kit, such as gauze, tourniquets, and pressure dressings, with the addition of basic airway adjuncts and tension pneumothorax mitigating devices. We usually see nasopharyngeal airways, or NPAs, used on patients with compromised airways. They are able to be used on conscious patients and are straightforward to use. However, due to the vascular nature of the nose, there is bleeding risk involved. Additionally, NPAs are contraindicated when there is facial trauma or the patient has polyps in the nasal cavity. To use, simply apply lubricant to the NPA, face the bevel towards the septum of the nose, and insert it until only the flange is protruding. Chest seals are used to prevent and mitigate tension pneumothorax, which is when air becomes trapped between the lungs and the chest wall. As more air finds its way into the chest cavity, pressure increases, straining the heart and lungs. Chest seals, the name implies, are designed to prevent air from making their way into the chest cavity. There are two types of chest seals, vented and non-vented. There's a debate in the medical industry over which is better to use, however the effectiveness of both is similar. Vented chest seals allow the built-up air in the chest cavity to escape, while non-vented chest seals provide a tight seal that prevents air from escaping or entering the body. However, one can always burp a chest seal to help allow this air to escape. Adhesive bag, simply remove the backer and center the chest seal over the wound to apply. While chest seals may help prevent pneumothorax from developing or getting worse, they don't correct it. For this, you'll need a decompression needle. Traditionally, ARS needles are 14 gauge by 3.25 inches. However, the trend is starting to shift towards 10 gauge and 3.75 inches, as these have a higher reliability and allow air to escape the chest cavity much faster. To use a decompression needle, you'll either want to locate the anterior second intercostal space or the lateral third and fourth intercostal space, depending on which method makes the most sense for the situation, i.e. whether or not the casualty is wearing body armor. Then, keep the needle perpendicular to the body, insert the needle all the way to the flange. After waiting 5 seconds, pull out the needle, leaving just the plastic tube in the body. Now let's take a brief look at ACLS, specifically how it pertains to airway management and ventilation. In basic life support, we learn how to open the airway using either the head tilt chin lift method or the jaw thrust maneuver. But how do we keep it open? NPAs may be ideal in some situations, but the nasal passages are very vascular, so they do carry a bleeding risk. As such, they shouldn't be used on a casualty with facial trauma or nasal polyps. This is where OPAs come in. Oropharyngeal airways can't be administered to conscious patients due to gag reflex, but don't carry the bleeding risk of an NPA. As such, they can be used when there's facial trauma or suspected fractures. To place an OPA, first you'll want to size the airway. With the flange of the patient's teeth, the tip of the OPA should reach the angle of the jaw. Then perform a head tilt chin lift to open the airway and begin inserting the OPA upside down until you meet resistance. Remember not to force the OPA. Lastly, twist the OPA and insert the rest of the way before using tape to secure the airway from being dislodged while transporting the casualty. While mouth-to-mouth is no longer recommended for CPR, there are still times when you may need to breathe for your patient. In these cases, rather than risking disease transmission or providing less than ideal breaths, a bag valve mask is the way to go. A pocket BVM, such as this one from Rescue Essentials, is ideal for the non-hospital setting as they're compact enough to take just about anywhere. Some BVMs are O2 tubing compatible, which is a great compatibility for those working in a hospital or ambulance setting, while others do not. BVMs provide better ventilation and don't carry the same risks to the provider as rescue breaths. They also help prevent aspiration by keeping excess air from being pushed into the stomach. However, one must always be vigilant for overventilation, as this can be extremely dangerous to the casualty. Remember, on an adult patient, the goal is to make the chest rise roughly 2 inches and allow the chest to fall back to the natural position between each breath, which should be administered once every second. Now that we've examined the components of a trauma kit, let's take a look at what one looks like put together. So military IFACs come in a variety of shapes and sizes, but this is a pretty standard one meant to go on any sort of MOLLE back surface. Inside, there's an insert, which is designed to be tethered to the inside through the grommet hole. However, this is just for demonstration, so I have it separate. The chest seal also doesn't fit very well inside the insert, so I just keep it directly behind it inside the pouch. And the insert itself will also fit very well inside a highly strategic multi-mission hanger, which is my preferred method of carry. though in the future I will be getting a couple of configurable med trays from Spirited Systems to use to hold all this equipment instead. As I said, we've got a chest seal, and then opening up the insert itself, we have the majority of the supplies. We've got a pair of trauma shears, nasopharyngeal airway, both hemostatic and traditional gauze, an ACE wrap to use as a compression bandage or to stabilize or immobilize a limb, a couple rolls of traditional gauze, and some gloves for PPE. The only thing I don't carry in this kit that you'd otherwise see in a military trauma kit is a decompression needle, simply because I don't have the training to properly execute one, so I don't feel comfortable carrying it. Other than that, this is pretty much what you would see in any military IPAC. Now let's take a look at a little more robust of a kit. This is a Max Mission Fatty Pouch, which I've curated with my own equipment. On the front mesh panel, I have an emergency blanket for mitigating shock and hypothermia. And in the back, on the PALS webbing, I have my trauma shears. They're always easy to access. Opening it up, you'll see it is jam-packed full of equipment. I have multiple Kelly clamps and a couple of bandage shears. I've got a nasopharyngeal airway, a couple of scalpels. Back here, I have some wound closure strips, surgical pads, non-adherent pads, and of course my chest seals. In the center, I have a roll of medical tape, which always finds use. A couple oral pharyngeal airways. This is sized for both myself and, well, my ex-wife. Some traditional gauze, a couple sets of gloves, a compression bandage, some hemostatic gauze, and some more regular gauze, because you can never have enough gauze. As you can see, it's a pretty simple kit, but carries just about everything you would need for traumatic injuries. Thanks for watching. If you enjoyed this week's video, please like and subscribe, and let us know in the comments below. And don't forget to check out our website, modernwarriorschool.com, to stay up to date with all our latest developments.